Welcome back to Connect MKE. I'm your host, Andrea Williams. If you're just tuning in, we've been discussing your health with #1 New York Times bestselling author, Dr. Ian Smith. He has a long list of credentials that include creating 2 national health initiatives, the 50 Million Pound Challenge and the Makeover Mile. He has also served 2 terms on the President's Council on Fitness, Sports, and Nutrition. Welcome back, Dr. Ian.
Glad to be back.
Thank you so much. Now, in the last segment, we discussed your latest book, Burn, Melt, Shred. Now I'd like to talk about health in general. So we're going on, 3 years now dealing with the pandemic. And there's a study that was published in the journal Nature Medicine. Scientists are reportedly finding that the coronavirus has far-reaching effects on beyond the acute phase of illness. And this recent study suggests that people with COVID-19 are at an increased risk for cardiovascular diseases for at least a year after recovery. Have you seen this study, and what does that say to those people about really strengthening their heart health?
Yeah, I haven't seen this particular study, but I'm not surprised by it. We have known now for a while that unfortunately some people are called long haulers. And there are people who have supposedly recovered from the acute illness, infection of the disease, but they are suffering from some of the complications. And some have been, over a year of experiencing COVID-related consequences. So I'm not surprised by this study. There are probably going to be a lot more studies. We're still early. COVID's not over. The pandemic is still going on. Fortunately, the numbers are dropping. They've dropped precipitously over the last several weeks, but it's going to be a while. This is how science works. Science takes a while to gather the data and to analyze it and to come with some type of conclusion, if any. It's going to be a while before we really know how long the impact of a COVID infection really is, but there have been all kinds of indicators, not just cardiovascular issues, but people are reporting dermatological issues with their skin, joint issues, hormonal changes. So there are all kinds of things. COVID is one of those things, which is why we've been so concerned about it in the medical community. It is like no other. It has affected almost every organ system, and it's unpredictable. And it's something that it's a very viable and fierce opponent.
Wow. And it really is scary, but like you said, we're kind of just making our way through this journey, and you're learning new stuff each and every day. I do have some questions from a few viewers. They definitely want to get your expertise on these things. So our first question comes from Nishana.
Hi, doctor. I had a question about the belly fat and how to get rid of it.
For years, I have said to people that it's not possible to do what's called spot reduction, which means lose weight only in one place. Some would say, well, I just want to lose weight in my stomach, leave everything else alone. Well, in the old days, we said you really can't do that. You have to lose weight everywhere, and your belly will be included. Now we know that there is something called intermittent fasting. And intermittent fasting has a lot of positive benefits. And one of the benefits is that it can help reduce belly fat, because what it does is it drives your body into your fat stores, and it takes your fat, which is a storage form of energy, and it converts the fat into a usable form of energy for your body. And so intermittent fasting does that. So IF, there are 2 different types, major types. There's time restricted feeding, where you have a 24-hour day and you break it up into an eating window and a fasting window. Everyone has heard about that. But there's also the 5-2 method, where there are 5 days of typically normal eating and 2 days of very low calorie eating. That's a different form of intermittent fasting. But in general, the concept and the methodology of intermittent fasting can help with the belly fat. Also, I recommend people do not eat within 2 hours of going to sleep. Increase your protein intake and get sleep. People who have belly fat issues tend to also have very bad sleep habits, and people underestimate or are unaware of how bad sleep hygiene can impact weight gain, particularly around our abdomen.
And we should just remind everyone, you have a whole book written on the intermittent fasting, so that's something they can look up as well. A question now from Andy.
Hey, Dr. Ian, I gotta ask, where do you find the time to lose weight?
I always say to people, listen, it's all about priorities in life, and this goes beyond weight loss. People have to frequently go back and sit down with themselves in a very reflective moment and think about what's important in their life. And if you're someone who is tired of being overweight, you're suffering from weight-related issues like high blood pressure, type 2 diabetes, or whatever, if you really feel like this has had a negative impact on your life, then number one, you have to make it a big priority. Number two, you have to make an appointment. I mean, we make appointments to get our cars fixed, to get our hair done and our nails done, and all these different things that we have to schedule. But we should schedule time for ourselves when it comes to exercise, when it comes to having alone time, and also when it comes to going to the store and making sure you have the proper foods to fuel your body. And so I hear when people talk about having the right time to lose weight, but nothing is more important than your health, because without health, you don't have quality of life. And I think people really have to work on getting their priorities together and deciding what's most important. I think once you do that, it still doesn't make it easy, but it makes it easier because now you are lending yourself to a commitment and making time so that your health is a priority.
Oh, great point. And we'll take one more question. This one's from Maureen.
Hi, Dr. Ann. I'm wondering how I can increase my metabolism after menopause.
Yeah, this is a question I get all the time in my Facebook group, Burn, Melt, Shred. Actually, it's one of the topics of my Facebook Live sessions. Menopause obviously can be very frustrating. It's inevitable. It's a hormonal milieu change that occurs with women around a certain age. And unfortunately, one of the byproducts of it is a slowing of the metabolism. You can increase your metabolic rate, your basal metabolic rate, BMR, by actually increasing your lean muscle mass. People wonder why men tend to lose weight faster than women. It's not that men are better. It's not that men are doing more exercise. It's that men genetically have more lean muscle mass and less fat, a ratio. And muscle mass is more metabolically active. It makes you burn calories faster. So one thing I encourage women who are dealing with menopause is to actually do more resistance training in addition to cardio, but resistance training to build up that lean muscle mass to increase your metabolism. The other part I recommend that people do is that they need to increase their protein intake. Protein and fiber make you feel full longer, but they can also take a while to digest. And the work that your body takes to digest protein can also be a temporary metabolic increase.
Okay, so doctor, that would be for perimenopausal women and postmenopausal?
Yeah, I mean, there are distinctions between those who are peri and post, but both of those strategies can be helpful in both states for sure.
All righty. Well, I wanted to talk about something as we wrap up this segment. We talk a lot about the disparities in the minority community. Some of that's due to systemic racism, economic inequality, not having access to healthy foods, you name it. But you've got diabetes, with African Americans dying at higher rates in every major city in America. Infant mortality, where African Americans have 2.3 times higher infant mortality rates than whites. And then heart disease, stroke, colon cancer, the list goes on. So knowing that those disparities exist, what do you say to those people who are living with these ailments and these scenarios? How do they change their mindset on how to better manage these conditions or avoid something like colon cancer?
We've been talking about these disparities since I started doing, medical media, medical journalism. It's been a really long time. The disparities have gotten better in some places and worse in others. And basically, there are a lot of underlying, we could do a whole show, by the way, on these disparities, but some of the underlying pinnings of disparities is having equal access to healthcare, having quality food nearby. People live in food deserts where they can't get quality food nearby that's affordable. Sedentary lifestyles. There are things that African Americans can change on their own. There are things that the system needs to be better. There's institutional racism and inequality. There just is. It's just a fact, whether people like to hear that or not. And so the system can be improved, but also while the system is being improved or people are working to improve the system, we as individuals have to take ownership of what we can do. And so eating more fruits and vegetables, being more active, staying away from high calorie drinks and sugary drinks. I mean, there are a lot of things that we do and the behavioral decisions that we make that we really can change, drinking more water. And so I want to encourage people, yes, it's important for the institution as a whole. Healthcare institution needs to change, but those are glacial changes. It takes a long time. They're slow. There are things we can do right away in our lives, and I want to encourage others to do that, to take ownership, seek out help, information. My Instagram page, as you say, at Dr. Ian Smith, spell the doctor out, Ian Smith. I give free information on Instagram, on Facebook, and there are other people. So people take a few minutes and look up some credible people and see some of the advice that they're giving and some of the information they're sharing to help make changes in your life right away and to make them very actual.
Well, thank you so very much for all the great information. It's always a pleasure talking to you.
Thank you. Good talking to you.
I encourage everyone to check out his latest book, Burn, Melt, Shred. Follow him on Facebook under Burn, Melt, Shred and on Instagram at Dr. Ian Smith. And that's going to wrap up today's show. I'm your host, Andrea Williams. As always, thank you for watching, and I hope you join us again next week as we connect you to the people and the issues that affect where we live, work, and play. Have a great day.